So we are 2 o'clock here, East Coast time. I wonder where you are all. I'm just gonna wait maybe 1 or 2 minutes just to allow our students to come in to the room. Today we're here to talk about the changes that happened at the NBDHE guideline. We're gonna dissect the guidelines together. I'm actually gonna pull up the PDF right out and we're gonna just really look through what they have said and really just being able to look at every single word that is important for you. So again, we're just waiting for a few friends to arrive here. In the meantime, I would love to understand, where are you from and when are you graduating? If you want to put it on the chat, let's test that as well. So let's see who's here and what everybody's saying. We have Florida, 2021, May 2021. Thank you. We have, I feel like I do recognize some names. Some of you, I think we've been communicating via email. Some of you, I do feel like, yeah, definitely communicate with all of you. Okay, so we have December 2020 as well. Wait, maybe you're saying 2021? Or maybe you already have graduated too. Okay, California. Okay, so we have friends from really literally all over the country, East Coast to West Coast. I just want to tell our Canadian students, this is a US based NBDHE guideline update. The Canadian guideline update, I will send a separate email that says, hey, we're going to dissect the Canadian guideline. Okay, I'm sorry if you are here, maybe you wanted to get an update on the Canadian guideline. I apologize, but you will have a separate email from me saying, hey, I would like to invite you to the separate guideline. Does that make sense? Trinidad, I do not have my calendar right here in front of my eyes, but I promise. Are you registered with us, Trivana, or you do not have StudentRDH yet? Let us know. Let me see. Oh, you are registered. Okay. So if you have, even if it's a free trial, you will get emails from us. I just want to make sure that you're registered. In that case, you're registered with our Canadian website, because our Canadian website and our US websites are different. I just want to make sure that all of our friends understand that. And that said, we are almost at 200 people here. And I just want to make sure that we are all here because of the US guidelines, okay? I just want to make sure everybody understands that. Okay, that said, are we waiting for any of our more students here? Professor Mas, are you here? If so, I just wanted to see if your students were here with us today, or I should wait for them. All right, so a lot of you are probably taking it this coming spring. Am I correct? Or is anybody taking it? Thank you, Professor Mas. March 11th, okay. Anybody taking it afterwards? The reason I am asking is because just depending on when you're taking, you might get the long version or the short version. We really are going to talk about, well, both today, because actually the guideline is the same. There's just different number of questions. So current about, well, whether you can take long or short format examination. So I just wanted to point that out in case you're like, oh, I really wanted to take the short format examination, but hey, I don't have it yet right now. So let's see, we are again at almost 200 students. Let me just start sharing some of my screens and then we'll be able to actually dive right into what you have to know for the NBDHE guideline. This is a pretty comprehensive guideline. Anybody have read it so far? Anybody has read the guideline? I just wanted to say, ooh, Miranda, you have, wow. Well, good for you, because it's a pretty lengthy guideline. I'll be very honest with you. When I was a student too, I just skimmed through it. I didn't really think I needed to dissect the guideline. So that's why I'm doing it for you, just in case you have not done it yet. And there are some things that the guideline does not include that I really, really want to tell you as well. So I'm going to also record this session with your permission as some of the students, because they're at school, because they have other things, they're not able to attend. So I'm just recording it as well. Okay, now one last thing, I wanted to clarify before I share my screen is the fact that this guideline can change any date again. Hi, Jesse, I think I just saw you in the other webinar, did I? Just suddenly I see faces. I'm like, yes, I remember you from the other webinar. Okay, so what I want to say is this guideline can change any date. It is my job to keep looking at you. So trust that this will change, okay? Everything that you see here are correct at the time being, but maybe in April they will change it again. So again, I will send you an email. If you are subscribed with us, you will continuously get updates from us, and I will tell you exactly what has changed, and you'll continuously be able to chat with me. So again, do not trust it, because I've seen, for example, last year they changed it about 3 times. Okay, so you know, this is not the final answer to everything. That said, let's totally dive into that. I'm so impressed by all of you showing up today. It's incredible, guys. Okay, let's start with this one. So this is the actual guideline. On January 1st, I literally logged in and I said, did they release the new guideline? And luckily they did. So I wanted to just pull this out. Usually I actually put a PowerPoint presentation, but I said, why don't we go this together? That might be more effective. So here I have again the guideline, and let me just keep scrolling down. Now the first page, honestly, I don't know, important. Obviously, we know what's going on right now, right? So it has impacted our program, okay? There's a table of content. I'm gonna skip through all of this so I can directly take you to actually really what's important for all of us. And let's see if this pen function works for us. I just want to highlight things as we go because it's a lot more effective that way. Okay, so now we are here. It says licensure. I'm not going to go over it because I'm assuming that if you are here because you can take the examination, I believe all of you will be ethical. We're not talking about that. But here, now we need to start. So this is page 5 in their guideline. And here they're talking about the tooth numbering system. Our Canadian students have a different tooth numbering system. Our US students here for the NBDHE are going to use, well, the Universal National Tooth Numbering System, which is also called Universal. So my professor used to tell me it's like Universal, like USA. I'm like, oh, okay, that sounds good. So that's what I've been saying the whole time. So that, and then after that, did anybody have a question about the hard guidelines? The hard pressure, no, sorry, not the hard pressure. Oops, can everybody mute your audio, please? I think we just have a background noise from one of our students here. Can we please try to remove that background noise? Thank you very much. Okay, so that said, here, as you can see, there is this area that, oh my God, sorry, I don't know what's going on. Sorry, I'm just gonna try to, okay. So hard associate A, oh my God. Sorry about that, guys. I don't know why it's like that. Okay, let me change it to a thinner one. Okay, it's gonna work now, okay. So you can see, they said the new guideline will be reflected in now. So they started in 2020. In 2017, they released a new guideline, but what happened? It took 3 years to be implemented. That said, it's gonna be the same for what the AP classification. So they released this in 2017.
Oh my God, I should not do that. 2017. And then what is going to happen is they're going to implement it. Look with me right now. Fall of 2021. That's a long way from 2017, but generally there's a 3-year or more lag. That's what you're going to see in fall 2021. And look what they say afterwards. You want to see what it says? During this transition period, it is recommended that individual become knowledgeable in what? Both classifications. So can you tell me in the chat, which one are you using in your schools? Is there one that you're using more than the other, or are you using just one or the other? I just want to know where you stand. So we have staging and grading. Which one, the new one or the older one? Okay, so a lot of say new. Okay, we use the new one. Guys, if you have not learned anything about the old guideline, you have to go back. It's the 1999 guideline. It's a really, really old classification guideline, but either set can be used, okay? So if you do not know yet what the new old classification guideline is, you got to find a way to ask your professor, hey, I read the board examination guideline and it tells me I need to know both. What do I have to know about the old guideline? Now we have our tutoring programs too. Amanda, she's a professor, amazing. She can also give you a summary of that. It will be an exclusive update for also our Success Package members. So you will also get an email from me. I was just waiting to see what they were going to say actually about the new hypertension, new AAP classification. So Professor Mas, you're saying they use both. Okay, that is great. So again, if you're taking it before fall, know both. That said, they can still change and say, well, actually, no, August, we're changing everything already. We're done. So that's why you need to keep an eye on this. Let's continue with this story. Or anybody have a question so far about the AP classification guideline? You would love to know more about the tutoring, Molly. That is fantastic. So what we have right now is a tutoring program where you can sign up separately and you get about 8 sessions per month. So that's Tuesday and Saturday. Our tutor, so she's our professor, goes through important topics such as the AP classification for new versus old, or really things that you have to know for radiology. And then she also takes all of your questions. There's a special chat, there's a special discussion board about that. You can put all your questions and your questions are going to be answered in that exclusive chat. So you have, let's say you can say, hey, I really don't understand staging and grading. She will write those out for you to answer you, and I will be there too. So Char, I'm taking the exam tomorrow. Do you think the new will be on the exam? Again, it says new and old, use both, okay? I'm sorry, I really do not have the answer for that. Oh, we have a friend, Botian, saying tutoring with Professor Michel is amazing. Thank you so much for saying that. So if you're interested, go to StudentRDH. There's a tutoring program that you can find. Let's continue. What do we have to know about this specific guideline? The multiple choices question only. Yay, because I don't know if anybody have taken exam here a while ago, because they used to have some old, like, just odd stuff such as matching, things that didn't make sense at all. And I'm so glad they don't have those anymore. It is all about just multiple choice. So that makes our life easier. And I completely support that, because I don't think they need to make our life a little bit more complicated by throwing us some different type of questions. So multiple choice, yes. Anybody who's happy about that? Every year I'm looking at the guidelines like, please make it easy, please make it easy. And they are just making it simple for everybody. So here, that said, we have this big word over here. COVID-19 has created blah, blah, blah. Basically, it means that not everybody has been able to take the examination because, as you can see, with social distancing, they also have to take students from every single other examination, such as nursing, electricians, and everything else. So they had to squash this 350 question examination, but they couldn't compact it. So what they did is they said, we're just only going to give you 155 items. For example, if you had 5 teeth to scale, suddenly you have only, well, 2 teeth to scale, or just like your board examination. So that became the short form examination. Nothing really has changed other than they said, hey, we're going to give you less time. The reason why they did that is because normally you would need 8 hours to finish the examination. If they give you 155 questions, you'll be done in the morning. You'll be done with half day. So they can take more students who are taking other examination or other dental hygiene students. Instead of giving one person the whole day, they can take 2 people. So that's the reason why they have done that. So do we understand how many questions? I don't think that's difficult, right? Now let's dive into what is in the examination, right? So Anel's asking, would the points be more? And in a way, yes, because there's just less test items to score, right? So they only offer currently the short format examination. They do not offer the long format examination. You do not have a choice right now. That said, this can change again any day, depending on how they feel, how your proctoring center, and that can be state by state, city by city, really just, we don't have clarity on that yet because of COVID. We thought the vaccine would solve anything. It totally is not solving anything yet. I think we have a long way to go. So you do not have a choice. If you are taking it this year, you can pretty much assume you're taking the short format examination. But whether you take the short format or long format, at the end of the day, you're probably wondering, what am I going to be tested on, right? So the way they have described it is like that. They say discipline-based components, what? Versus case-based items. Okay, what does that mean? Discipline-based, meaning that there are 3 categories. 3 categories are science. For example, head and neck anatomy. You can understand that is basic science, right? Nutrition, biochemistry, microbiology, pathology, pharmacology. Those are basic science items. So you can expect, let's talk about just the short format, 25 items on this. If you take the long exam, it's 61 items. After that, you have the big bulk of the examination is actually what's called provision of dental hygiene services. So let's dissect what that means. That means being able to read or assess a patient using, well, medical history, to doing probing, to, you know, head and neck and, sorry, not anatomy, palpations, evaluation, radiograph for sure. What about giving them the treatment, right? That could be anything from instrumentation to ultrasonic, for example. We can also treatment plan them, present the case as well. Other than that, you can also use chemotherapeutic agent. It's not just about instrumentation too. What about fluoride? Fluoride and other things you can provide, oral rinses, dentifrices, all of those sealants are also within, they call the provisions of dental hygiene services. And then let's continue, sealants. What about supportive treatment? So that could be polishing, that could be materials, that could be impressions, desensitizing toothpaste, things like that. So those are all additive, those are supportive treatments. And then anything that has to do with your ethics, your conduct, those are the things that are going to test you. This is called the provisions of dental hygiene services. So it is a really, really long list of things. So, but basically everything that you're going to do when you have a patient in your chair, from assessing how they're doing to being ethical, to looking at the chart or charting, gathering information through medical history and everything else you can think of that you're going to render as a service. This is the big bulk. And then this is still session 1. Okay, I call it session 1 just for simplicity. Instead of calling discipline-based component, I'm going to call it session 1. So in session 1, you also have community oral health. So community, well, it obviously asks you about promotion of oral health in different groups, meaning they could be geriatric, they could be the younger groups as well. And then literature, statistics, things like that, designing programs, AdPi, you know, those things. I mean, no, AdPi is for clinical. Community would be a little different, but you will have all of those in community. Now, one thing I want to point out is this. There's 10 items. That might not look a lot, right? But compare it with 50 items here and compare it with 25 items here as well. If I do the math, they are, let's say 85 questions over here. Let's say, just talk about the short format right now. There's 10 items over here. So let me pull up my phone and do the math really quickly. So, or anybody can do the math for me right now. What is the percentage of that? So around 11%, let's say about 12% of the examination of session 1 is about community. When you have oral pathology to study, head and neck to study, when you have everything else to study, as StudentRDH, we have 17 chapters. Community oral health is only one chapter, but it is at a volume of 12%. That's actually a lot if you think about it. So if I could give you one tip, is studying community is really, really important. I don't know if you were a big fan of studying community oral health when you were at school, or you are at school right now. I'll be very, very honest. It was not my favorite, because you know what? I mean, obviously it's great to do, you know, education, and I also can provide some care for the seniors, and it's also great to tell them to stop smoking. It's so great that I was just a little confused that when I was at school, and Peyton, I think community was hardest for me in the examination. And it will be extremely hard for you in the NBDHE too. We're gonna go through the questions they have over here. They are very hard because again, there are a lot of gray zone. So this is my recommendation. When you go to the examination with community, go with the mindset of choosing the best answer, because you know what, A, B, C, they all make sense. D also makes sense, but then you're left, okay, which one is the best? I like to think about that. I mean, honestly, so I own 5 of the same t-shirts because I like to wear the same thing every day, so I don't have to think about it. I used to love fashion, but I just don't have time now. So anyhow, I have 5 of those, right? So if I had like other shirts, which I still do, guys, okay, this is not the only thing I wear, but I'm like, this makes sense, and it's a little warmer today, so you know, I can wear my blouse, but which one is the best today? Well, because I'm presenting, I should probably look a little bit more professional, right? Or because I'm graduating, I want to wear red and look great on pictures. So it is just about which one is the best, okay? So please get into that mentality, because otherwise you're going to feel like they're trying to trick you. You're going to be like, oh my God, I totally failed. You know, they made this, so I fail anyways. And you're going to tumble into this negativity. So that's what I wanted to tell you. Okay, then let's talk about case-based items. Those are case studies. 70 items. Okay, well, how many cases are you going to see then? So Leah, you're asking, sorry, they're going to be 155 questions instead of 350 in the short examination, okay? So they say 150 here. Wait, they made a mistake here. It should be 150 here as well. I'm telling you guys, they make a lot of mistakes too sometimes, so you got to read it really carefully. Okay, I can tell you this is 150 questions if you are is the full examination. In the short examination, they only use about 40%. That's 70 items. I should probably write to them saying you got to change your typo here. Okay, so I think that's why you were confused, Leah. Totally not your fault. So 12 to 15 cases, that's again, the long format in examination. So in your short format, you're gonna see about 5 to 6 cases. Each case is gonna have about 10 to 15 questions, right? If you do the math, you just get to 70. Some cases might have a little bit more questions than others. That makes sense, right? And what are those cases composed of? History, chart, radiograph, and photograph, right? If you have StudentRDH, if you've done other mock examination, you know exactly how it rolls. And they're gonna be the click, click, click tab, okay? They're not gonna give you everything in one format, format. You have to go through each tab in order to understand the case, build it. Now, this is the really important part I wanna highlight. Here, each examination includes at least one case regarding patients of the following type. Meaning you're going to have patients of each of those conditions, or not conditions, but each of those patients, which you're going to have a geriatric patient, you're going to have a child patient, you're going to have a perio case, you're going to have a special needs case, and a medically compromised patient case. So think about it, could be someone who is 80 years old, who the other person perio involved. Well, that's where the AAP classification comes in. You need to know that really well. A pedo patient, special needs, okay. You have to also understand with maybe cerebral palsy. There are many things. Down syndrome, medically compromised, from something like hypertension to complicated diseases, or it could be autoimmune diseases, or it could be liver, anything. So medically compromised patients, okay? So you will have all of those patients given to you. So if you are doing some mock examination, whether you're using your textbook or StudentRDH, and you're only doing one type of adult patient, that's probably not my recommendation. You really need to make sure that you get patients that are old, that are young, okay, know how to read the pedo chart as well, and really learn about medical conditions, because you will see patients who have conditions. And can you see that every single patient will come with history. History includes pharmacology is huge. You'll have to know the drugs and their dental implications. So I think we covered that, what actually you're going to see within each section. Now, back in the days, that was about 5 years ago, they gave you, it was a little easier when they were like, oh, you're going to have about 5 questions on oral path. You're going to have about 10 questions on dental anatomy. They don't do that anymore, okay? So at StudentRDH, we obviously look at the old guidelines, how we've been teaching, and kind of base it on what happened earlier. But nowadays, they completely change how they tell you what is going to happen. So for example, we have students that may think, oh, I had a lot of questions on pharmacology. You know what? Your questions and your friend's question are completely different. And it comes from this very, very wide, okay? You can see how wide it is, right? This very, very large pool of questions. So they're going to look really, really different. So you might hear some things, but know that your questions are different from your friend's question. So there's no special recipe. I'll be very, very honest with you. You just need to know as much as you can, and just hope that what you have studied will be on the examination. But I feel like my job as StudentRDH is to give you all the real basic that you need, so you can build your story, so you can build your case, so you can build your logical thinking when it is the examination. I'm not going to go over too much about what a case looks like, because if you have mock exam, you probably know already kind of what it looks like. This is a pedo case. You will also need to know things like that. Charts might be look a little different. That's why we have a variety of charts at StudentRDH as well, so you can get used to many different types. Now let's talk about what a testlet is. A testlet, that's just their way of saying it's like a little case study on what community health. So testlets is only about community. Remember, there are 10 questions if you're taking the short mock about community oral health. And it looks like this. As you can see, there's a profile. So something's going on in a certain community, in this case, in coal mining company, their employees, and you get all this data. And you are supposed to be able to answer all of those questions. So that is a testlet. Remember, there are 10 questions. So you would get about 2 of those case studies, or sorry. I should say testlet or community health little cases. Any questions on that? I know case studies are really important, but right now we're talking about community, and I keep mixing the words, but we're talking about a short format for community oral health. Now, regardless of what section it is, whether it's session 1 or session 2, whether it's a case study or testlet or a simple item, you will have 3 formats. Now, in my head, when I saw the new guideline, I just said yes, because I like it. There used to be more formats, they reduced it. So that's really focused on what you know and you don't know. You don't have to deal with weird formats or them trying to judge your English. So this is about, do you know it or you're not? So let's just look at one more thing over here. So here, at least 3 and not more than 5 possible responses. I wanted to highlight that you can have 3 answer choices up to 5. Generally 4, but there's sometimes 3. So at StudentRDH, we give you sometimes answer choices where you only have 3. That's on purpose because we want to kind of really give you a realistic view of what's going to happen. Sometimes you have 5. Now, one more thing here. You have to choose what is correct or best. Again, I want you to go with the mindset of you might have to choose the best answer because it's not always about the correct answer. Sometimes everything makes sense. Which one is the best? You guys follow me? Because this is a really important point, and I know I keep mentioning it, but I will mention it until you understand because it's super important. Okay, so let's look at the 3 type of questions. And Beth, I got your question. So we will dive in that false first statement and second statement as well, okay? So the first type of question is very simple. Is, well, you're gonna complete the end of the sentence. So here in this case, the sensation of touch, pain, pressure, temperature is determined by, and then you just trying to answer the question, or not the question, to finish the sentence basically. The second is how you are going to have a question mark at the end of the sentence and being able to just answer it. So very simple. Which muscle does the phrenic nerve innervate? Well, you got 4 answer choices. You're very used to that, right? The last part is negative, meaning there's an accept or false in your question. So here, each of the following is affected by saliva except one. Which one is the exception? So you're just trying to one that is not true. So if you were on our case study workshop today, you will know that I like to play the true and false game, meaning that you'll have to try to break it down with me and understand, is this true or false? So instead of jumping right into a conclusion, just take one moment, okay? And say, is this true, 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 false, or which one is the false? So in this case, which of the following affected by saliva? Each of the following is effective except one. So 3 of them are affected by saliva. So it would be 3 of them were true. 1 of them will be the exception, which is false. Does that make sense to you? Again, I'm trying to break it down so that we don't panic when you see questions like that. Anybody had the experience when you're like, I thought I had it correct, and you go back to a professor and say, I thought I did it. I had an A, but when you look back, it's like, oh, I made a mistake. So those exception questions are a little tough. Just take your time. Students have way enough time to finish the examination. They do not feel like they didn't have enough time. So please know that it takes only 10 more seconds to do that. Now let's dive into this first statement, second statement, right? The reason why I didn't prepare PowerPoint presentations because I wanted to, again, read directly the words from the guideline here. So the first statement, second statement questions existed until 2 years ago. That said, usually, as I mentioned in the beginning, it takes about, I would say 3 years to really see changes happen. So those type of questions will still exist in your exam. It's not here, I know. Why do they even do that? I don't know. So that's why at StudentRDH, sometimes students or professors ask me, why do you still have it? Because I know they're not completely gone. We still want you to practice those, okay? So you're less shocked. I would rather you to study more than less. And when you see that, you're like, oh no, this is not happening. I want you to just be prepared. So just know that you're going to see, still see those, okay? Beth, does that answer your question? You might not have a lot of them, but again, you still will. And they will just continue be erased. So maybe next year you might see that it's completely gone, but right now in 2021, we will still be seeing those. Okay, I think I said it a lot of times. I think you got this. And just in case some students do not have StudentRDH and they might still have the question, did not attend the webinar, you can tell your friends, you can tell your faculties what I said, because that's truly what I believe is going to happen. Madeline, you have this question about related versus unrelated questions. Anybody know about what Madeline's talking about? There's some things I was like, the first statement is related to the second statement, but the reasoning is false, things like that. Okay, so that has disappeared about 3 years ago. Luckily, it has disappeared. I believe that this year is going to be the year when you do not see them, because again, we have seen historically that it takes a little bit of time. We still had students saying, I think I saw things like that, or you know, there were some things, but I want you to understand that it takes a bit of time. And even so, I should not really worry about that. You shouldn't really worry about that. Because really, I mean, if you ever see, that would be 1 out of 155 questions. So that would be my answer, Madeline. Does that help you? iPhone, you're asking, is that better to study from Mosby or Darby? It's such a difficult question. I don't know how to answer that. Okay. Without judgment, Mosby is very thick. You know, it's like this, right? It's hard. Darby is simpler. That's the only, reasoning I would say. Both of them have some case studies. Both of them are very extensive and good. But I prefer not to really tell you one or the other, if that's okay. Okay, let's continue here. Now, we have to understand how they are scored, right? Obviously, we all know that 75 is the minimum score. We know this, right? So 75, this is not the end of the story though. So some people ask me, hey, Claire, I heard they're scaled. What does that mean? And I'll tell you what it means here by actually reading from their own words, because I didn't want to twist their words. So they have some sort of scoring key that only they know. And they adjust for minor differences across examination forms. So let's say we have Madeline and we have, let's say, Sierra. And both of you took the examination, but one was a little harder than others. So they have their scoring key that kind of say, if Madeline's examination were harder, well, it's a little unfair to judge her just based on all the difficult questions that she had. So nationwide, they're still gonna, using their scoring key, adjust them. That's what they're doing. Also, what happens too is that at the end of the examination, just like at your school, so this happens at your school, say, let's say you had 100 questions, but everybody got question 99 incorrect. They look back at it and say, this was a bad question sometimes, right? And they throw it out. So sometimes things like that happen too. But again, how do we know what scoring key they're going to use or what you're going to get? That is something, to be very honest, that I cannot give you the answer to. That's why StudentRDH would prefer to give you the raw score, exactly how you score without any adjustment, because it is almost impossible to say your 85 translate to an 87. It's almost impossible to do that. So right now we just provide a raw score. But let's continue about some other things here. Did you know that you had experimental questions in the examination? They don't really tell you exactly how many, but some are experimental questions too. So out of 100, you have to take out those experimental questions because you're not going to be scored on that. So again, your 100 questions graded will not really be graded on 100. Maybe you're actually graded on 90 of those questions. And depending on how you perform on those 90 questions, your score would be very different. So experimental questions, but if they say here, you do not know whether it's an experimental question or this a real question. They look the same. They look the same to you. So assume every question is a valid question. Anything you want to ask me about this? I'm totally open. I'm can always try to answer the best way I can. Seeing thousands of students this past year, at least 3,000 students in more actually passing with StudentRDH. I probably have answered many different things. If you have questions later completely, it's okay, email me. Now, obviously you get a pass. They don't tell you, hey, you did 80 or 75. But if you fail, they do give you a fail report, okay? They give you a little bit more of a breakdown, which I do It's very hard to decipher that because it doesn't give you much information either, other than, oh, you didn't do well. This is the national average and you did this on like provisions of dental hygiene. Oh, not too much information. So unfortunately, it is like that. But when you fail, you do get some sort of information. How long does it take for you to receive this? Well, 3 to 4 weeks, although a lot of students see the results. You just have to log in. You see it earlier than that. So, by the time you finish your exam, and every day, I know you're going to log in to see if you have passed. But usually about 2 weeks is a good amount of time. All right, let's continue. So there are some, I just wanted to add one more thing here. When you are taking the examination, you are saying, hey, I am going to also share this information with my dean or my school. You're already giving the permission, okay? So that is already kind of assumed. Now, audits. Anybody have heard of audits? Okay, so you can actually request an audit within 30 days if you feel like something has happened though, okay? You can't just request an audit because you have failed or you just didn't like it. You have to have a legitimate reason, and we're gonna talk really soon about what it is, what does it look like for you to have a glitchy computer, or what can you do about that. So I'm gonna just move forward here. I'm not gonna talk about all of this. Eligibility, again, I'm assuming you can apply for the examination. The fees here, okay, not something that we can control. Now, when you actually apply, you get a window of when you can register for the examination. Let's say March 1st to March 30th. But if there's something that you really need an extension, they give you an extension. Know that there's a fee attached to that. So try to sign up when you really have a good understanding of what is going to happen, when you really feel comfortable taking the examination. Now, for you to take the examination, you will need some sort of sign up from your school that says, hey, she or he is ready to take the examination. One more thing here is if you want to reschedule, you can. However, that is going to be at a charge. Not much, okay, it's okay. Hey, rather to just feel comfortable than not feel comfortable, okay? So you have 24 hours notice. You need at least 24 hours. So let's say you're gonna take it tomorrow at 8 a.m., it's too late. But if you're gonna take it on Friday at 8 a.m., it's okay. You can still ask for a reschedule. Make sense? Now let's talk about the format. The format, this is the long format examination, okay? Session 1, Session 2, break. They're only kept once here session, and the short format examination. Sorry, they totally threw me off because this is also, I believe, a typo. This is not discipline-based, it should be case-based, patient cases. So you're gonna be quizzed on Session 1, which is kind of your oral anatomy to fluoride to dental anatomy, head and neck. And for an hour and a half, you will have an optional break, meaning that you can say, yes, I want to take my break, 15-minute clock. I strongly suggest you take that break, go stretch. You cannot enter your cubby, your locker, or anything. Maybe go get some water outside. But if there's a fountain, but you don't have to, you cannot touch your locker. Just go outside, run, or just do something crazy that just gets your blood going again. Because when you sit for hours and hours, you know how it is, like we get really sleepy. So here, take your break, come back, and you will have case studies. Okay, here again, I believe they meant patient cases, not case discipline based. Everybody follow me so far? So the case the case studies are longer here. In total, 3 hours, 50 minutes. That means within 4 hours, you are done. Abby, you're asking, can we go back to the previous questions? Yes and no. Here's my answer. Why? Yes, because let's say you are within that first discipline-based, like Session 1. If you are within that first area, you can go back to the questions that you have done already, and then you submit it. And then you take your break. But after you submitted your questions, you cannot go back to the ones that you wanted to change. Does that make sense? So you can change them as long as you have not submitted. Abby, does that answer your question? And I think we can all understand that, right? They don't want us to have a break and come back with like a different information and change our answer. All right, so I think we're doing excellent over here. Now let's fast forward to the day of the testing appointment. Okay, so this is what I was saying. If your computer is glitchy, if you're like, my mouse is not clicking correctly, if something is going on, this is when you have to raise your concern immediately. Here it is. You should not resume until the issue has been documented and resolved by an administrator. Okay? And sometimes if you go through it though, not resolved at the time of the testing, you must submit, okay, in writing, what you have seen, what the problems were within 5 business days. So my recommendation, if there is a problem, just stop, make sure that they know there is a problem. I don't want you to continue, okay? And then, they will help you out if they can. If they cannot help you out at that moment, they will do an investigation and they will come back, okay, have you retake it within 30 days. The reason why I'm mentioning that, I know it's a very small area, but I've seen a lot of students actually having problems with their computers. It's from anything to not being able to see the screen correctly, having a little weird spot on the screen, to the math not clicking correctly, or the exam submitting before they thought they submitted anything. So those are really, really important problems. Okay, so please raise your concern. Sorry, Molly, if you were to fail, how long do you have to wait to retake the examination? Thank you for asking that. Oh, sorry, suddenly got big. Let me see if okay. So you had, what was that, 45 days before you were able to submit for the examination. So you can't just take the examination back to 90 days. Oh, thank you very much, guys. 90 days to do it again. You cannot take it back to back. Does that answer your question? Thanks for Krista and Candy for stepping in. Okay, perfect. And can we have anybody share my email address? Is clairej@studentrdh.com here, Kieran. I just can't type right now while I'm doing this. Thank you though. And Molly, you said someone had told me 6 months and I was stressing. Okay. Well, also let's think about positive things that we are actually going to pass. Okay, so some of the last things I want to mention today is in the examination, when you want, so there's some students, right, who have some sort of disabilities, and those can also be learning disabilities. And I've seen those students too, and I coach those students too. So if you have those, you have to say that earlier. Do not apply to your examination yet. You will have to tell them first your condition with a complete evaluation. There's a whole list of things that you have to submit to them, okay? We're not gonna go over everything here, but you can understand they want documentations from doctors and this and that. They cannot just take self-evaluation, say, I have anxiety. So it needs to be documented and proven. But let's say you have something, you again have to tell them first, and then you will be able to actually schedule an examination. Okay, so here it is. Candidate can schedule a testing appointment only after testing accommodation have been approved. Sometimes, so if let's say you have some learning disabilities, they give you double the time, or you get 2 days to test. But again, this needs to be documented. This needs to be proven as well. So Gianna, Claire, can you touch on community included in session 1? I actually thought I had enough time, and when I submitted, the community test lists were included with session 1. Okay, I'm not sure I completely understand the question. So in session 1, community oral health is included, is within the amount of questions that you're going to see. So Gianna, you say you ran out of time. Okay, so everybody here, this is what's going to happen. Let's say you had, I'm just saying, an hour and a half. And if you run out of time, what's going to happen is that it's going to submit automatically for you what you have done so far. You're not going to be graded 0. Let's say you've completed until question number 90, and there were 100 questions. You didn't get graded on 10 questions, but you still got graded on 90. That means you can actually still pass, you know, even if you didn't have enough time. Does that help you, Gianna? I'm not sure if that was a question. Just wanted to let you know that just in case you run out of time, that does not mean you automatically fail. I hope this is good news for everybody. Right? Okay, and we had another question here. How many times can you take the NBDHE? We have friends who have helped already 5 times within 5 years. That is correct. However, please keep seeing the changes, okay? And I will update you if there's a new change, because it could, you know, change to 3 years within 3 times within 3 years. You know, things like that again can happen, and I've seen those happening. Thank you. Danya, you're asking, do they take the average of the discipline part and case study part, or do we need to get 75% on each session? That's a great question. So it's not like you need 75 on each question. They look at the total amount of question you got correct, incorrect, and again, put their key score that we really do not have clarity on, because every student's set is different, and being able to adjust the total amount of score. I hope this makes sense. Lizzie, you're asking, is it better to skip questions we do not know? And I think some of you know what I'm going to say, right? Well, the question is just pick something. Lizzie, there is a flag function. There's some flag function you can say that you can click on. You can tell yourself, I really didn't know that, I want to come back later. But in the meantime, just in case you run out of time and it submits for you automatically, just click something. You have a 25% chance or so to get it correct. Does that make sense? So don't try to skip anything. You can still skip the question or just choose something, flag. That would be my recommendation. When you are done, before you submit it, you can see all your questions that you've answered previously, including the flag questions. Go back to all of those before time is up. Okay, any questions on that? Thank you everybody for participating and asking questions and answering each other's comments. So really, honestly, this is the gist of what you have to know for the guideline. In a good way, they didn't include anything crazy this year, other than we already know there was a short format examination. They didn't change really how the different type of questions that you're going to see. They didn't put anything crazy. Just this one thing that is not on the guideline that you will still see. And then AP guideline, again, study both the old and new formats. And if you need some help with that, okay, StudentRDH, we have both guidelines. I made myself a task to fall comes. I'm going to delete the old guideline. However, until now, we have both like that. And for some of you who are here with the success packages, you will get special webinars on, well, how's the new guideline different than the old guideline. Millie, I see your direct message, and please email me and I promise you something, okay? Can I see a question from Louis? You're saying I signed up for StudentRDH. Is a 1999 guideline included? Yes. So it's like the older one and the new one. We tell you, so there's a session that's about, okay, what happened previously? And we have specific sections that are labeled new guideline. Okay, we call it the, we don't call it the new guideline per se, but 2017 guideline. So you will be able to see those. And we also have videos at StudentRDH about how to solve a case studies with the new AP classification, because I understand grading and staging. When I first saw it, I'm like, what is this? I didn't know, right? So I asked my good friend Amber, who is a international speaker on this topic, to create videos for us. Gianna, thank you. I look forward to have your direct message. And iPhone, sorry, I'm going to call you iPhone. You're asking, do you think question will be more straightforward on the short format? It has, I can't tell you that the questions themselves has changed. It comes from a big pool. So they just pull, let's say 300 questions just for you, another 300 for your friend, but they have this gigantic pool. So the questions themselves are not different. And actually the failure rate with the short format examination, I don't mean to scare you guys, it looks pretty bad. Do you know what the failure rate is? Nobody has announced it yet, okay? It's not something that is like out there, but just from my experience looking at our students, it is about 25, which would one out of 4 students will fail. And I hope that's not you, okay? Let me just lastly share one document that's about the short format examination. They answer all those questions here. This is within the NBDHE. When you sign up, you can go here and have all their documents here. So I'm not pulling something that you cannot find. Okay, this is all available, but you really have to take the time to decide for that. So they have created this earlier, okay, when they just started. That was in July. And what they're basically trying to say here is, can I sign up for the old and for the long and short format examination? The answer is no. You can only sign up for one. Okay, that's just the answer as here. And then here again, it says the content here in the short format examination is just proportional, meaning again that the questions themselves are coming, you know, from the same pool. Probably it's just proportional. So they just cut it by 40% or so. And then just in case you have registered with the long examination previously, it says here, all previously arranged testing will be provided for the short format examination. Okay, so that's what they're saying. And were the results for the short form reported differently? No, it is the same as, you know, the long format examination. So here it is. Until when are we going to have the long or short format examination? Here is say until the backlog of displaced candidate is resolved. And we do not know when it is, right? I mean, when are we going to get the vaccine? Anybody got the vaccine over here? Although this vaccine is not really something that's preventing you from getting the disease either, right? No? Okay. So, I mean, I don't know when I'm going to get it. It really depends on where you live and what they consider, you know, essential at that moment of time. But I just wanted to tell you that we do not know when the backlog is. So if you're counting on like, I want to only take the long format examination because the short format is, the failure rate is really bad, you know, I think you might have to wait a bit of a long time. So just dive right in, just do the best you can. And just one thing I said earlier is just don't beat yourself up either, because it's been a really tough year last year, and this year too, it's still going to be tough. You know, mentally, physically, everything is changing. So, you know, trying to just be kind as well when you're studying to yourself. So that's really the gist of, you know, what I wanted you to see here about the short format examination. There's nothing really that I can add to this. Although I'm telling you again, we are looking at it constantly every day. See if there's anything that we have to tell you, you know, we'll definitely send you an email. But, you know, I'm just hoping that all of you will be able to at least graduate on time, be able to take the test on time, and at least be done with this so you can move on with your career. In a way, you know, I think you guys are graduating in a real transition time. I mean, the AP classification transition, you guys are transitioning this professionally, this challenging time, but in a way, you're gonna have the safest infection control when you graduate. Like, you will never have to worry about infection control. Back in the days, they said they didn't have enough gloves. Can you imagine that? Like, do you feel safe working without gloves, without mask, without nothing? So that's what they did only like 40 years ago or something. So right now you're going to be on top of the infection control. Okay, maybe one or two questions here from our students. Is the Canadian board mainly on Darby textbook? That's, I mean, a very difficult question, Natasha, sorry to answer, because I cannot say it comes mainly from Darby textbook. There's a list of textbooks that you have to get in order to finish dental hygiene school. And it says anything can come from here. So it's very hard for me to say that. Sorry, I don't have the answer to that, Natasha. And Genesis, thank you for being supportive. Genesis saying, you cannot do it, ladies and gentlemen. We will pass this boards. Genesis saying, best wishes to you all. That's really kind of you. So just thank you, everybody. It's been 1 hour together. Thank you, Professor Moore, as well, and students for being here today. If you have more questions, let me know. You have my email, clairej@studentrdh.com. And also, again, if there are new updates, I will be here. I just hope that you all feel comfortable taking the examination. I hope you all feel comfortable asking me questions too before, you know, I feel like it is too late sometimes. Our team is here. If you need support from a tutoring program, to reach out to me, or you can go to StudentRDH to find out more about that. Okay. So thank you again, everybody. I did record this, by the way, so hopefully you can see it again. Hopefully nothing happened. No, I think we're okay. And that's it. Well, have a great day.